and gentlemen, we request you to take your seats and kindly switch your cell phone modes to silent. We have a very exciting session for the day and we will need your complete focus on the session, right? So, a warm welcome to all our speakers, delegates, leaders, innovators, founders, policymakers, and academicians, along with our investors, and all the members of the healthcare ecosystem joining us today. My name is Hanisha, and I will be your host for the day. NASSCOM Center of Excellence welcomes you to the 15th edition of the flagship program, Lifesciences and Healthcare Innovation Forum, focused on the theme The AI Edge, transforming care, costs, and compliance. Over the course of the day, we will hear from leaders across healthcare, government, academia, startups, and industry as they share experiences, use cases, and insights on how AI is reshaping healthcare and life sciences in India. With that, let's begin the day. To formally start this event and set the context for today's discussion, I would like to invite Mr. Sanjeev Malhotra, CEO of Mighty NASSCOM Center of Excellence. He has been at the forefront of fostering innovation ecosystems and digital transformation across sectors through emerging technologies. Ladies and gentlemen, let's welcome him with a great round of applause, please. Come on, it's beginning of the day and we need more and more energy from the audience.
Very good morning, everyone. Another fine morning in Bangalore and another fine venue for a great discussion and good day ahead that we have. As Anisha said, we are on to the 15th edition of this Life Sciences Healthcare Innovation Forum, one of the unique forums which we conceived and started about 8 years ago. And some of the people from the industry who have been associated from the first edition are here. I'm so happy. And Dilip is one of them. So very warm welcome, Dilip. And just to kind of throw some background on this, as you can see, the themes have changed and progressed from the time we started it from the first edition till now. And now, we are with the theme of AI Edge. You can see that, it's no longer a question of whether AI will do this or that. I think it is about who, how, and what will get impacted, which will come first, how to do it at lower cost. The discussion points have changed from what it was 2-3 years ago to now. And another thing we believe is, this AI as a technology is going to be impacting pretty much every part of the ecosystem, and that's where we believe that just to make this innovation happen, some of the new solutions, technology innovations will be coming from different parts of the ecosystem, whether it is startups or it is technology companies, medtech companies, pharma companies. And we need support of the government, academia. So many different parts of the ecosystem have to come together for innovation to grow faster, new solutions to come. India being having a different demography than rest of the world, has its own requirements which are different from rest of the world. So obviously we need to have our own strong ecosystem which will accelerate innovation. And that's the primary focus for Center of Excellence. And that's the purpose it was created. And that's what we have stuck to from the time we have been from our inception. And we are located in 4 different parts of the country and likely to expand from there. And with a single-minded focus of how do we accelerate innovation and its adoption in different parts of the healthcare and pharma. This is one domain we have been very much focused on for last 8 years now. And so happy that we have representation from different parts of this ecosystem here today. This is what this is meant for, where we have discussions about what has been achieved, We celebrate our successes. We candidly talk about the challenges, and work the rest of the year to address and bring some of the good solutions into adoption by different parts of the ecosystem again, by the hospitals, by the healthcare providers, and some of the solutions have gone global also. In fact, a lot of you may not know that some of the solutions made in Bangalore are being run in the Walmarts and the different large institutions in US. Some of the companies that originated in India are now providing diagnostic solution in rest of the world. So we'll talk about those good things as the day goes by. I just wanted to use this opportunity to welcome you all and be prepared for good discussion. And with that, I would like to invite onto the stage three leaders for this morning session, where we'll hear different parts of where we'll hear different stories, be it from their corporate side, be it from the healthcare provider side. So starting with Dilip Mangsuli, shall we please come to the stage? So those who may not know, Dilip has a very long career in medtech. I have known him from his GE days into his Siemens Healthineers days, and now he's the chairman of Siemens Cancer Hospital. I don't know the exact name, but he's the chairman of the Cancer Hospital Network in India, and we will get to hear. So he brings wealth of experience both from the corporate side as well as from the healthcare provider side. So please. So next, I'd like to invite Girish Raghavan. He's VP of Engineering from General Electric Healthcare, GE Healthcare, which has been spun off as a separate company now. Girish is a long-standing leader again in medtech, who's now currently leading global organization, R&D organization in different parts of the world. Whenever I speak with him, he's in a different country actually. So good that at least you could be here today. Just happened good that you are in India for this week. And he's leading some of the future technologies for the healthcare on the imaging side in particular. And we'll get to hear perspectives of how AI is impacting some of the R&D work in GE. Next, I would like to bring Dr. Uma Nambiar. So I don't know how many of you know, she heads a hospital in IISc. So I don't know how many of you know there is a hospital being built in Indian Institute of Science, right, in Bangalore, which is a very good step, right? I mean, bringing different disciplines of engineering sciences and medicine into one campus is going to be a very good combination, in my opinion, and we'll get to hear from her on some of the initiatives that they have taken up. So we'll start the morning by inviting Dilip onto the stage and hear some of your experiences of these hospitals.
Good morning. It's always a privilege to be the first one, especially looking at the two great persons sitting there on the stage who can make it even more interesting. So I get to set the bar. I know they will beat the bar. So I think today's talk is on AI, and I just wanted to really start with my thought process. When I was studying in IIT Madras in 90s, early 90s, that is time when we're talking about AI. And everyone was thinking that in 10 years' time, AI will be the game changer. And it took several years. It took actually decades. I think last couple of years, we are seeing a real transformation that is coming. I want to talk about who has the control. So I want to talk about why AI is going to be a game changer is because of the challenges that we face today in the world. And especially globally, if you look at it, 50% of the world is still not having access to healthcare. And the challenge is about, even in India, when we talk so much about hospital network being there, I still see a huge number of people having a challenge about access. About a year back, we had an incident in our office where early morning, someone who wanted to come early to office, and he was preparing himself to go to uh, religious place, and he was practicing walking. So our floor was on 8th floor, and he walked all 8th floor in the early morning, and he came and he sat on his seat, and he started sweating. And everyone thought he was sweating because of the climb that he had. Then he was breathless. And suddenly my assistant was there in office at 8:30 in the morning. And someone reached out to her that, he's not feeling well. So she looked at him and immediately knew there was something wrong. So he got the wheelchair. We had an ambulance always ready. We moved him to hospital in 7 minutes in Electronic City, in 7 minutes exactly. And when he reached there, the doctors were ready and they checked him. He was having a heart attack. And immediately before his wife could come, they could do the procedure to revive him and get him back to normalcy. And he survived. Today he's doing great work, continuing to be a part of Siemens Healthcare. That was a brilliant story. There was another case, a friend of mine who was a lieutenant in army. He had retired and he was staying in the outskirts of Bangalore. One of the fittest persons that I could ever see, not a inch of fat in his body, and every day perfect exercise. And the person was walking every day 20 kilometer kind of a thing. And night he developed some unease in the night. They tried to move him to a nearby hospital. There was no equipment or a doctor available. They tried to move him to 2-3 different hospitals. By the time they took him to a hospital, which was the good one, they basically declared him dead when he reached. A man less than 60 died. So that brings to the question, where you live should not decide if you live. This is something, a profound statement. For me, this always makes me wonder, are people who are living in certain places privileged and some not so privileged? This access has to improve. There's going to be a shortage of nearly 10 to 18 million healthcare professionals by the year 2030. And that's going to be a huge challenge. How do we manage that? And also we know the number of our population is going to grow drastically over time. And with the reduction in this number, what can actually change? Can we get that many more people trained? Now, Dr. Uma's hospital is going to train a lot of doctors, but will it be enough? There are going to be many hospitals which are coming up. Many doctors still need to be there. I see how much struggle I have when I'm trying to recruit a doctor in all our 17 hospitals. It's a struggle to get a doctor. And that's where technology can that help. And if I walk into many of these hospitals, the OPDs are full. There's no place to sit. And this is where the technology can bring in, the internet getting faster, data management becoming faster, computational power becoming faster, AI becoming the way of life. Can that change anything? This is a story that I want to tell you. I traveled to Dehradun, a village near Dehradun last year. And I was a part of a delegation which was trying to understand how the TB screening works in the villages, along with the government of India, ASHA workers. I went to different houses in the villages, met with people who were being encouraged to go for a health screening. And they were never told it's a TB screening. TB, as you know, probably one of the big killer disease even today, with nearly 1.3 million people dying of TB and nearly 10 million new cases being added every year. And India is contributing to 25% of the TB patients globally. There are billions of dollars being invested to really eliminate TB. And it's still a big challenge that every country is trying to tackle. Now, the story here is very simple. You look at this, there's a woman who is standing there getting her X-ray done. And this X-ray was being taken with a handheld X-ray. A handheld X-ray as big as a SLR camera is being used. With the help of AI, the screening tells you if the person is a suspect. If the person is a suspect for TB, he was immediately getting the sputum collected. The person was getting sputum collected, and the person will get into the treatment mode. And this, believe me, was such an amazing work that was being done by people with the least amount of skills. The technicians who were working on it knew how to operate the camera, they operate this X-ray unit, and the AI. And interestingly, all this AI that was approved by WHO, couple of companies which are Indian origin, Q.AI and Deep Tech from India. So a big kudos to them. And for me, this was a real case use of everyday challenge that we are facing, how this is changing the game in TB detection. Otherwise, it would have been very challenging, difficult. And these camps happen almost every day in the country. I visited one in Chamarajnagar in Karnataka as well. So that's a brilliant approach to bring that AI into a change. Now look at this, a case of X-rays. When you look at the X-rays, there are nearly 3.6 billion chest X-rays are taken globally. And to read this takes a lot of time. And nearly 74% of these X-rays are normal. Now, if 74% of the X-rays are normal, if a radiologist is looking at them, that's going to be a time not utilized well. And that's where AI comes into play. Radiology as a service is something that every company is trying to look at, deploying across the countries, across the world. I think even in UK, in NHA, the challenge is in terms of reading the X-rays takes a lot of time, sometimes months. So if there's a person who is critically ill, how do you really manage that? And this is where the technology brings in the acumen. And you can focus on the right areas at a right time. Now, this is a galaxy. Look at the galaxy. This picture, unfortunately, because of lighting, does not show all that great. But there are certain red lines or red letters. This is like a galaxy. This is not a galaxy, real galaxy. This is a data galaxy. We did a work with University of Essen in Germany to find out how does the patient data of a cancer patient work. And this data is about cancer patients. And every node that you see is a department, and every line is a flow of data from one department to another department. And there are red lines which you cannot see, but I know it is there. Those are the reports or tests that have been done and generated. So these are used to deploy to different departments to make an assessment about the patient's condition and treatment needs. Now imagine this data is of single patient. Okay, single patient data. It is not a multiple patient data. This is a single patient data. And if one has to make a decision about the treatment efficacy based on the latest data and the relevant data, it becomes very challenging. This is where AI is being used to bring in with the workflows what is relevant and what is the right way to manage that. And that's going to change the game in the future. In our cancer hospital today, when we look at this, we use a lot of AI to create a central treatment planning for patients, to look at the patient positioning. When we are using Ethos, one of our greatest of radiation therapy machines, we use patient positioning using AI techniques, which will ensure the right dose is given at a right point, because you don't want to spoil or you don't want to kill the healthy cells. And those are the game-changing efforts. What's going to be the future? I think AI is here to stay. There's no question on that. Now the question is going to be, how do you really change the game further? One of the startling fact about the hospitals that we have in cancer care, we have 3 out of 5 people who are being treated that come for palliative care. That means they have no hope, zero hope. And if you look at the other countries, I've seen personally my own colleagues of mine in the past who were detected with cancer, they all came back normal, treated, because they were being assessed pretty early for screening and they got treated early. Unfortunately, in our case, that is not the case. So we are trying to look at digital twinning, which can help us in predicting early diagnosis and early treatment. And those are the futuristic things that will change the world forever. And I'm looking forward to a day when most of us will have it's not about disease, it's about quality of life with an early detection and an early treatment that can bring in a better healthcare, not a reactive healthcare, but a proactive health management rather than disease management. Thank you.
Thank you, Dilip. As he talked about, some of the AI-related diagnostics being used. I don't know how many of you know of a company called Remedio here, which is based in Pina, making devices which are AI-driven eye care, basically. It will detect glaucoma and some of the other eye disorders. And they have an installed base of more than 5,000 in US. And they've been doing that for last couple of years. So there are a lot of good things happening right in our neighborhood, but we are not aware. And there are a lot of good success stories and a lot of good new applications. So with that, let's invite Girish Raghavan to hear the corporate world, what's happening on the best, some of the best companies in the world.
Thank you, Sanjeev. I've been with NASSCOM in some other form for the last at least 5 to 8 years now, and I want to really thank Sanjeev and NASSCOM for all the partnership. The value we get from NASSCOM is phenomenal, right? Especially the kind of work they do. I also realize I'm the only person with a sweater here. It's also machine learning. From the last 2 LHIF, I realized it's pretty cold. This room is very cold. So I realized that my internal machine learning worked pretty well. So in the next 10 minutes, 11 minutes, I'll just walk through some of the things we are doing in GE Healthcare, especially in the space of AI. Sorry guys, AI doesn't work. Okay. Can you go back? Go back. Okay, I hope this works now. Okay, so in this picture, you are seeing two bar charts over here. One, the life expectancy is 87 years, other is 67 years. Anybody here can say which country these are from? 67 is India, okay. US. Anybody else? Japan? Sorry? Bhutan, okay. Okay. So you'll be surprised to know that both these are in US, okay, and they're just 500 miles apart, okay. The 87 is in Chicago and the 67 is 500 miles away from Chicago. So what I'm trying to convey here is it is not that we have healthcare issues in in the Western world. It is a wonderful thing, and it's worse in India or on emerging economies. It's pretty much the same across the world, right? It's not very distinctly different across places. Um, okay, so I think Dilip covered a bit of it. So I'll just reiterate some of the things. You'll find the numbers varying. Dilip will say 2.6, I'll say 3.6. There'll be some numbers, but directionally you get the point, right, of the volume of things we are talking about. So as Dilip mentioned, 1 out of 5 of us in this room will have cancer in our lifetime. That's the reality. This is also an industry where we are seeing the highest amount of burnouts. 54% of the radiologists report they are experiencing burnout. This is also an industry where 100% attrition happens every 5 years. Okay, this is a lot of people. I think there is some study which says that 72% of the clinicians do not want to come back to the same profession if they have a choice, right? So the burnouts are very high, lot of hard work, very tough, so on and so forth. And Dilip covered this about 11 million. So he said 10 to 18 million. So it's somewhere around that figure. By 2030, you'll have a huge shortage of trained resources. When we say resources, healthcare workers, one is doctors. It also means clinicians, technologists, radiologists, technicians. All are part of the healthcare worker ecosystem. And we are seeing a huge shortfall by 2030. And finally, the access is a big concern. 4.5 billion people will not have access to healthcare the way we have today by a possible future. So these are some of the pressing challenges we are facing in the industry today. This is of concern for policymakers and leaders across the world. And how do we tackle this challenge in a very effective way? And if we don't do it, it's going to go out of proportion very quickly. Okay, but things are not as gloomy as it looks like, thanks to of course AI. So today we talk about smart devices and AI coming together to solve some of the most pressing problems healthcare is facing today. One, of course, is the patient health. It is about so we can make a difference with smart AI in terms of providing good access to patients. Okay, good accurate things to patient. We're talking about reducing burnouts for hospital staff. We are today talking about AI, how it can help to solve. And Dilip mentioned a couple of examples. I'll just talk one or two as well. Then there are a lot of discussions about how do we make a difference with smart devices and AI to improve workflow by providing seamless integration between devices in hospital, which are so diverse, right? If you go to any hospital today, you'll find so many IT systems. They don't talk to each other. It's such a pain to go to the IT infrastructure. And finally, how do we increase access with all the shortfall of resources and staff across the world? Even if you have the cheapest CT on earth, if you have the cheapest MR on earth, you need people to operate those systems, right? So that's a big challenge industry is facing today. So what I'll do the next 7 minutes, I'll just pick one example each from each of the 4 pillars and just articulate what the industry is going through. There are a lot of examples today. Many companies are working on it. It's not only GE Healthcare, but I'll just pick one example from each to just drive the point that how AI is indeed in real time making an impact on healthcare. Because there's a lot of buzz around saying AI is just hype, it is just on paper, it is not real, and so on and so forth. This will just give you some examples of what we are doing today with AI. First is about patient health. So all of you know mammograms. We spoke about 1 in every 5 people will have cancer, but among the women, it is extremely high. It's number 1 cause of cancer today for women is breast cancer today. And as all of you know, cancer, when it is, especially breast cancer, when it's detected very early on, the probability of you getting recovered is extremely high as you find an earlier stage. But as it progresses, becomes extremely tough. Stage 4 is extremely complex, and so on and so forth. So what we have found today, the studies which says that 29% of cancer detection can be reduced. You can have better detection of cancer if you use AI. And this is a well-known study which has been figured out. So in many hospitals today across the world, you have the human work happening. Humans do look at cancer, but they also use AI. And thanks to AI, they're able to detect cancers 29% higher than they would have done otherwise. Thanks to that, many women today, because of these technologies, are able to get treatment much ahead of time. So AI plays a big role here, and this is all real data what we're experiencing today. Okay. So AI is not only about the patient outcome, right? If you look at the breast cancer example, it's also about the technologist and clinician's efficacy. So today, if you look at a typical mammogram, I don't know how many of you have experienced that, right? If you go to a mammogram hospital, if you go to a hospital where they're doing mammograms, you got 20, 25 exams. I have seen one hospital where they do 60 per day, 60. Okay, it is huge volume, right? And every mammogram, it's not like X-ray, right? You have to have a lot of attention because it's very difficult to differentiate a lesion from a I would say high contrast tissue. So it needs a lot of attention so that you just don't miss it, right? And actually AI helps there as well, because thanks to many hospitals, what they do, I know of, where they have readers who look at the lesion, they make decisions, but they also have a subset of images which actually go through a third-party system, okay, where they use AI to go back and look at the same data. And we have found that the first set of clinicians who had seen the mammograms, they would have let it go, saying it's fine, but the AI catches it later on, and that has actually helped to improve the quality of care in a lot of places. So AI is not only about solving a problem, it is also about complementing what has been done by clinicians and technologists to solve some of this. So this is basically about the patient experience and patient journey. The second example is, I want to catch us about burnouts. So here I would like to take an example of a typical emergency room, what you would have in any hospital. So just take a situation where at 11 p.m. in the night or at midnight, you have a patient walking into, say, Manipal Hospital or Dr. Uma's hospital, and you have a patient there, and typically in the nights, you don't have the best radiologist sitting over there, so you're taking an X-ray scan, and thanks to AI, we're able to find pneumothorax very well, right? So you take an X-ray scan, you press a button, it will automatically do the assessment through AI. It will be able to overlay, as you can see in the chart, it can overlay the pneumothorax over there, and it can even say with what level of specificity and sensitivity you're providing this information. And thanks to that, the radiologist, the junior radiologist sitting in the hospital can make choices to say, do I have to call the clinician? What is my standard operating procedure? What I should do next? So these are one example of a real situation which actually happened from a tech center in India, where we have built this solution. This is used across the world in a lot of places to solve some very pressing problem. If anybody here knows what is pneumothorax, it is so life critical, right? You just can't take a risk in that. Time matters quite a bit. So this is one which is used in emergency rooms quite a bit. So this example on burnouts. The other example I would like to take is about workflow. So all of you know, I mean, some of you might know about AirRecon DL. This is actually GE's flagship deep learning algorithm which has been developed. Today we have 50 million users. Patients have gone through the AirRecon DL solution, right? So we are going one step ahead now with what we call the Sonic DL. And here we're talking about reducing the scan time. So my dad actually had been to an MR procedure maybe 2-3 months back. He's 80 plus. It's so painful, guys, right? In a conventional MR, you have to hold your breath for a long period of time. You have to be in the MR for a very long, it's noisy, it's so painful, it's so frustrating for a patient to go through that. So thanks to something like Sonic DL, where it can actually reduce the scan time significantly, right? We're talking about reducing the scan time from minutes to seconds, right? Again, it's all deep learning algorithms which have been used today clinically. And then it also helps to correct blurs. Today, one of the big challenges in MR is that you have to hold your breath, you cannot move, etc. So using today AI to correct the blurs and then send it across. It can also help to reduce rescans. I know a lot of MR and X-ray cases, and we'll talk about X-ray in a minute. The retakes are extremely high because the patient would have moved a bit. You come back, look at the reports and say, you have to go back and take a scan again. So this is one example where we are seeing deep learning algorithms helping to solve some real world problems today in healthcare. And to add to that, today it is not only, so one is you of course get clinical efficiency and efficacy, but thanks to these algorithms, you're also able to do procedures which you could never do in the past. If you go back and ask any hospital, they'll say that MR is not for heart, right? MR is not for heart because it takes a lot of time, right? So look at this example, what we're showing here, right? From a speed perspective, in a traditional one, and that is what with Sonic DL, what used to take 10 seconds, if it goes for a much longer period of time, and you can do it in a much lesser second, especially for heart, right? If you look at heart today, you have to take the MR completely within a very small period of time, right? And that actually makes a big difference. So you can see 30 frames and 58 frames. You get 30 frames at a longer period of time and 58 frames at a shorter period of time. 1.45 seconds to 0.24 seconds. So that is all the value what these algorithms brings into picture. Significant impact in healthcare space thanks to AI, guys. Okay. The last one I want to talk about is X-ray. I know Dilip touched upon this a bit, but today, Dilip said 3.6 billion. This is 2.6 billion. So the X-ray is basically the most imaged I would say modality today in the world. 2.6 billion X-rays to 3.6 billion X-rays per year is what we have today. But we have got two problems in this, right? We have many problems. One of the top two problems is we have 25% rejections. You take 4 X-rays, one of them is not good, and you have to do a retake, And I don't know how many of you experienced it. I've experienced many times. I had a fracture. I go to a hospital, take an X-ray. I go home. Then somebody calls me and says, "Come back again. You want to take an X-ray again?" Right? The rejects are extremely high in X-ray. The second problem is we don't have experts who can operate the X-rays, because a lot of the radiologists, or not the technologists today, they want to graduate to CT. They don't want to work on an X-ray modality. That's number one problem. Number two problem is a lot of X-rays today are in tier 2, tier 3, tier 4 cities. You go to a village, you can find X-ray system, right? So you can't find good people who can operate those systems in those places. So these are two problems what we are. So what we are doing as a company today and is about how do we make things more autonomous, right? So we are trying to have smart positioning. So we are using camera, we are using I would say VLMs, vision language models, which can actually position and help to avoid the repeat rejects, right? Which means you can use cameras to position properly and then take X-rays well. We're also trying to make the life of a technologist much more simpler by providing a very guided workflow through which, so essentially we're talking about a world where you just walk into a room, you stand there, the system will detect where you are, it will just take it will position itself depending upon the protocol, what is requested. It will take an X-ray, it will just do the checks for you, and it will tell you, you're good, please leave, right? Or it will say it's not good enough, maybe you should take an X-ray again. So in the process, we are going to solve both the reject issues. We are also going to solve the problem of workflow management as well. So these are some of the examples which I thought I'd share with all of you. But thank you for your attention. And I want to conclude saying that AI is, in fact, significantly impacting healthcare delivery today. It is no more a buzzword. It is real. People starting to quantify. We don't have good data to quantify the value proposition yet, but we are seeing papers coming out where they're going to show some good one. And many companies are working towards it, and we are one of them. Thank you.
So do these X-ray machines or these MRI machines and the CAT scans come built with an AI now? It's built.
Today, if you look at so the days have gone where X-ray systems are just dumb systems, right? If you go back and see 5 years back, 8 years back, X-ray systems were dumb, and you want the operator to be super smart, right? So today it's the other way around. It doesn't matter how good or bad the operator is. X-rays comes with a lot of inbuilt AI capability, like our cars today, right? If you have a car today, 5 years back you have to be an expert. 10 years back you have to have an expert to drive a car in the city. In Bangalore, you should still be an expert, but in other parts of the world, you can still drive a car if you have to have expertise. But today, thanks to all the technologies, you have reverse parking, you have reverse camera, you have those hundreds of sensors which will help you and guide you to be efficient. So that's exactly what we are doing in healthcare space as well with AI.
Thank you. So before we move to the next session, so Dilip, one thing, do you think that AI will help us find a cure for cancer? How many people here feel that AI will help us? First, let's hear from Dilip and then.
I mean, I can't say that it'll happen in next 5 years or 10 years. But over time, definitely, once we start looking at more understanding of human body, today it is so challenging. More we get the help of these computational capabilities, we'll be able to do a personalized treatment, which will definitely cure. Today, it is a very generalized treatment. I think once you get into a personalized treatment, we'll get to that mode, and that's going to be helped only with AI.
All right. So we have some pharma companies represented here today from AstraZeneca and Sanofi and others. So let's hear from them later on in the thing, what all medicines they are working on, that and where AI comes into play. So next, Dr. Uma, stage is yours to tell us, given that you're an ISC, are you the most advanced technology hospital in the country, or is that your aim?
Hi, good morning, everyone. So before I start, I just want to show of hands on how many of the people here are from healthcare provider ecosystem. Okay, I see about 5 or 6 people. All right. And how many of you are engineers who work in the healthcare related industry? That's far more. By the end of the day, end of whatever I discuss, I will tell you how I define the healthcare provider ecosystem. Okay. So way back when Mr. Tata envisaged the IIC as an institution, let me tell you that in his charter, he had not only the basic science and engineering, but he also had healthcare in the mention of a charter in 1894. And that's something which tells about the vision which laid the foundation of the Indian Institute of Science. I think I don't have to tell the audience here about the IIC, but I think this was just to set the stage of why we are doing the hospital within the campus of IIC. This is not, we are not making a hospital just because we want to run a hospital. Okay. There are enough and more people doing that, and I don't think that you need one more hospital to be set up in the country. But there is a reason why we decided that Indian Institute of Science is the right place to set up the hospital, which could be considered as a template for the hospitals of the future in this country. And the reason to do that is, if you see across the globe, the Indian healthcare provider ecosystem is considered very favorably in terms of delivering good quality care at a cost which is very easily affordable to a large majority of the people. Having said that, also the pharma industry of India, I mean, we are known as the pharmacy of the world. But you look at innovation in the space of technology, bringing out the equipments and devices that are an integral part of delivering healthcare. We really lack in that space. We are dependent on almost all, in all spaces, in all specialties, we are dependent on the imported technologies. And India cannot have self-reliance in healthcare if we do not do technology on our own. So we need to invent, we need to innovate, we need to discover new technologies from India. We have, if you see all the big companies across the world where we have big, technology development happening, a lot of workforce is Indian. Now, most of them went out of this country because we do not provide the right ecosystem for them to be able to nurture their ideas, to help them innovate. And the reason why the Indian Institute of Science is making a hospital is to really fill this gap. We need a place for the engineers, for the basic scientists, to be able to interact with the clinicians, to see where the problem cases are, and to have patients and to see upfront where the problems are, so that we can think of how to provide the solutions. And that is the precise role that this hospital is going to actually fulfill. We have large number of basic scientists. We have almost every engineering discipline at the Indian Institute of Science. We have a lot of them doing research in healthcare. So what is required is to fill the gap was to make a hospital. And you'll find that even without the hospital, there are areas where the scientists are already doing research. So there are enough engineers, we have enough, we have 2 centers where we do a lot of research related to neuroscience. We have the Center for Neuroscience, where also a lot of scientists are working on devices and equipments related to healthcare. So again, whether we talk of AI, digital health, cancer research, vaccine research, and this is without the hospital being there. Now, if you need to, and during COVID, it was figured that, when they wanted to do trials on patients, you couldn't go anywhere to the other hospitals. So today, the scientists in IIC depend on other hospitals in the country, and it's very difficult for you to go to a hospital, find time from the doctor, actually be able to see a patient. So distance really makes it very difficult for that communication to happen. So if you have a hospital in the same space, and you can walk across from the hospital to the lab for the doctors, and from the lab to the hospital for the other scientists, it becomes easy to work together and to think together to innovate for future. So these are some of the areas that we thought, and which we think that which are our primary focus areas today, where as the hospital starts, which will open the hospital in another year and a half or so, it's under construction and being equipped at the moment. So since our labs are already working in infectious diseases, vaccines, working on cancer, projects on diabetes, projects on integrative medicine, we have not only allopathic disciplines, but also Ayurvedic medicines being researched on, and some of the pathways in Ayurveda are being worked on. So all of that we are trying to work on. Now, by no means this is an exclusive list. When we set up the hospital, we will have more than 85 clinical departments. You name it and we'll have a department. So every department or every clinical discipline is being thought of as being housed in the hospital. Although I mentioned few specialties in which we will start our research interests, but any area where either we feel from the hospital that there is a need, or from the engineers who want to develop something for the healthcare field, they feel that there is a need, we can work together to actually make that happen. So typically, it's about creating an ecosystem for co-creation. Now, when I say that we are creating that ecosystem, it is not limited to people who are working in the ISC or in the ISC medical school. That system is open for anybody who wants to do research with us, who wants to work with us. And as we said, I mean, we have partnered with Siemens and GE and the other many companies here as one of the first in the country really to have a large industry academia collaboration to make sure that some of the technologies of future actually come out of our hospital or I would say our center. What is difference in the medical school that we are trying to make? This would be the first center in the country, or the med school in the country, to create what we call physician scientists or the clinician scientists, which has an integrated MD PhD program. Why do you need a clinician scientist? Because when we want to work with industry collaborators, when the doctors and the engineers and the scientists have to work together, first, the doctors need to really take the problem to the engineer and explain to them what the problem is. So you need to be able to speak the language of the researcher. After that is done, and let's say some development has happened and a product has been developed, you need to take it back to the hospital so that you can do the clinical trials on it. So you need these clinicians to really validate that the product that has been made is the one that we wanted. And once the product has been made and we want to take it to the market, you want to speak to the other clinicians and the other healthcare providers. Now, who would do the speaking? You actually need somebody from the same healthcare community to do the speaking, to explain. So really, today there are these gaps at either end of the spectrum of developing a product and taking it to market, and to actually, making a difference in the outcome of the patient. At both ends of the spectrum, if we empower the clinician to speak the language of the researcher, this need would be met. So this unmet need is going to be met by these clinician scientists that we will train at the Indian Institute of Science. And hopefully, this will then become a template for the future for the other medical colleges to follow. Since we have the possibility of, not only this dual degree, the clinicians also have the ability or the freedom to choose and do, let's say, an MD and MTech, or to do an MD and an MPH. So this is something that the doctors can choose from. And if you want to do an MTech in biomaterials or data science, that's a possibility that the doctors will have with us. While we are making this hospital, we are also making sure that we are benchmarking it at a global level. We are not making this hospital which is limited to benchmarking it within the hospitals in India. We want to make a global center of excellence, and therefore collaborating with global best-in-class organizations to make sure that we have advisories from them, clinicians from them, research collaborations and partnerships. And some of them, as we speak, are already underway. And as we progress, we hope that we will have many more such collaborations. So this will be an 832-bed hospital to start with, and we have space for about 1,100 beds as we go. So hopefully, we will be able to house many of these specialties. Having said that, for a country as large as this, and for the global impact that we want to make, you will know that 800 or 1,000 is hardly a number of beds that we can really hope to serve the aim with. This is where we want to look at collaboration. We want to use technology to see how we will be able to impact or reach out to the nation of the other institutions using digital means and tools of communication to see that we can do collaborative research. And that's where partnerships are going to play a role. And we will make sure that we cater to the patient population that serves the interests of research and acute care, and all the others. We have other collaborative partners, other hospitals and institutions that will work with us. Of course, just like any other hospital, we want to make sure that we provide equitable care and reach maximum number of people in the country. And this is what the hospital would look like. So, hoping that we will now open this country for, let's say, a new model of healthcare delivery. This is a private hospital, housed in an academic institute, fostered by collaborative efforts between industry and academia. And just like I said, a couple of differences. Okay, this is my last sentence anyway, so I'm about to finish. That one thing that you will find we are doing in the hospital, which you will not find in other hospitals, is that we are setting up incubation centers for engineers and doctors to be able to start up companies within the hospital. We have spaces in the hospital where if you make an equipment which weighs 20 tons, I will provide you beta testing space for the equipment. And this is something which hospitals don't do. So we not only have one or two, we have 3 beta testing labs. We have the entire hospital, which is probably the largest wet lab in healthcare across the globe that you will find. So please feel free to collaborate with us. And with that, I would like to end the note for today. Thank you.
Thank you, Dr. Uma. So we heard how the education is going to change, and as we talk about the importance of domain and knowledge of sciences and data sciences. So one question for you, remember, we all go through this 12th class, and if you're in a science stream, you'll take engineering or you'll take medicine. Will we have a third option called both?
Yes. So just like how we think that we are going to have the clinicians do a dual degree. Let's say if I want to do an MTech in biomaterial engineering along with my MCH in neurosurgery, I'm welcome to do that in ISC. I'm hoping that some of the engineers will also take up a fellowship in medicine and do some healthcare program with us.
So education profile could say I'm BTech and MBBS both.
You could do that. So I want to actually end just one more thing. I asked in the beginning about how many people from the healthcare provider ecosystem. And I want to tell you that when we work together to develop a technology and we do patient care, all of you engineers sitting over here are part of the healthcare provider ecosystem. After you've sold the equipment to me, you damn well be our partner, because if the patient sues me for a wrong image or a wrong AI algorithm written, you are equally liable. So I will put vicarious liability on you guys. So consider yourself as providers of the healthcare ecosystem. Look at the patient first. Don't look at how much money you will make with what development of what technology you are going to sell to me. That's not where what the game is all about. It is about being together in the patient outcomes.
Thank you. So great research innovation ecosystem being created in Bangalore. With that, we come to an end of this session. We have very interesting things lined up, and hear from the government some of the stupendous initiatives taken on the data side, which is the cornerstone for AI. So with that, we thank you so much to all the leaders here.
Thank you. We request the leaders to stay back. I request Mr. Sanjeev to felicitate our speakers. Come on, let's not hesitate to give them a great round of applause, right? We had heard great things from our leaders today, from data to bringing AI into the tier 2, tier 3 cities and villages of our country. Thank you, Sanjeev and leaders.